Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who primarily attended reporting a blocked left ear. So this is their left ear on view at the moment. And this is their right ear. We can see it's also blocked. So we're going to commence with their left ear first. And this actually is an earwax. It's an accumulation of dead skin, dead keratin. And they are suffering from a bit of otitis externa at the entrance of the ear, which is causing a bit of dry, flaky skin to surface, and a bit of inflammation, which means the entrance of the ear canal is quite narrow. So what I'm having to do is use the side of the endoscope, as I am now, to stretch this ear wide open to allow me to insert my instrument. But because the endoscope is being used to dilate the ear canal, the tip of the endoscope is in very close proximity to the dead skin, so you may have noticed there's a lot of reflection there. So to combat that, I just reduced the exposure on the device, which means there's less brightness, you get less of reflection, less glare. And now that I've cleared the entrance of the ear canal, I can put the exposure back on. You can see it's a lot brighter because I'm not getting that same. We are still getting a bit of reflection. You can see that happens when you've got dead skin in the ear, but it's less so now. The way I know it's dead skin as opposed to earwax, it's for two reasons. You can tell by the colour. It's got a more pale colour than earwax, and especially if you compare it to their right ear, which there is earwax in there. And it's the consistency. It's dead skin like this. So this is just turning over a lot of skin, dead skin, and this dead skin, as it's dying, it's shedding and sort of migrating out of the ear. It's just collecting in the ear canal, forming a plug. And mushy dead skin like this, it's almost like a clay consistency. It can block the suction probe, so we've got to be careful. And I made not a mistake, but in hindsight, I wish I didn't do what I'm going to do next. In a moment, because this plug of dead skin, it's just, as you can see, it's a bit trapped at this point in the ear canal. And I've put some oil just to lubricate the side walls. So I decided to use a Jobson horn. And this is probably why sometimes, I know sometimes you feel that I maybe should be using these instruments, but this is exactly why I in the past normally avoid it, because although the Jobson horn got a bit of this dead skin out, but what it did, it's because of the consistency of this, it spreaded this dead skin almost like butter on toast. It's all smeared at the bottom now. So although I got a sizable chunk, you can see all that smeared. So I decided to stop using the Jobson horn, and I'm now going to just revert back to suction. Obviously an ear hook is not suitable for this type of consistency. It's just going to cut through it like a hot knife through butter. You can see that at the bottom, it has smeared it a little bit. Okay, it's more superficial in some respects, so it's not going to cause them a problem. A bit gooey consistency. So for their otitis externa, because it's more superficial, it's just at the entrance, they're going to sort of have some acetic acid first. Once you enter the ear, you'll see it's a lot more healthy in there. But if that's, they do get a bit of psoriasis as well, so a bit of itchiness, and they're going to monitor their symptoms. Otherwise, they're going to need some prescribed medication. So the patient's going to notify us. They're going to try the over-the-counter acetic acid first. And if they're still symptomatic in a week, they will contact me, and we can refer onwards. Now, with the doctors, they can prescribe some antibiotic and steroid spray, but you got to obviously, if we are being overprescribed antibiotics, we can develop immunity to it, and of course, you don't want to use steroids for if it's not necessary. So acetic acid, it's just a white vinegar really, but it's you can buy it for the ears in a spray bottle. And what the acetic acid is, when you've got a bit of otitis externa, it increases the pH level of your ear. So our ear should be slightly acidic, but when you've got this bit of inflammation, tinnitus, the pH level increases. It almost becomes alkaline, which then is less able to inhibit harmful bacterial and fungal growth. So acetic acid just re-acidifies your ear, and generally it does the trick. There's just some mushy skin at the top now. And the patient developed a gag reflex, so I'm just going to hover over. If it comes away, brilliant. If not, I'm just going to leave that, because when the patient and the gag reflex is actually quite a bit more prominent in their right ear, and you've got some of the gag reflex, and the gag reflex happens because there's a branch of nerves in the ear. It's a branch of the vagus nerve called the Arnold's nerve, and sometimes you can stimulate that when you perform earwax removal, and also other auditory procedures like taking ear impressions, for example. And this patient started to cough, and it was quite spontaneous, and it's able to judge. And obviously when the patient coughs, the head's moving, we've got 2 instruments in the ear, so we're going to be really, really careful. Now in this side, I just thought I'd use the Jobson horn to see if I can get in and behind, but the consistency of this wax is far harder, and it's almost solidified in the ear. So I'm going to use a hook. Now you guys may know, if you've been following my channel, I'm developing my own range of instruments, and in terms of the hook design that I've modified, it's a bit more tapered, a bit more narrowed at the tip, so it allows you to glide through. So where I am now, it's got a bit more taper. We're using a much stronger resin as well, so it's because in this ear, when I was using the hook, it is flexing backwards. I was worried it was almost going to snap. It wasn't going to snap, I was confident it wasn't, but it's almost like a pole vault athlete with their pole vault, and they're trying to get over the bar, and the pole vault flexes backwards and then forced to propel the athlete over the bar. It was that firmly wedged. So we managed to remove it with the hook. That's the eardrum. I hope you enjoyed that video, guys, and do take care, keep well, and speak soon. Bye.